So now we will talk about lung adenocarcinoma. Mutations in oncogene in RTK RAS MAPK signaling pathway have been identified in approximately two-thirds of the lung adenocarcinoma. RTK RAS MAPK signaling pathway have been identified in approximately two-thirds of the lung adenocarcinoma, are generally mutually exclusive with each other and have been shown to be bona fide drivers. Importantly, many of this represents actionable target with matching investigational or US FDA approved targeted therapy. So mutation. KRAS, that is most frequently mutated RAS family member of lung adenocarcinoma, and mutation in KRAS are observed in approximately 30% of the lung adenocarcinoma people with European or African descent, now linked to history of smoking. The prevalence of KRAS mutation in people of Asia or Native American ancestry is lower. KRAS G12CD mutation most prevalent and account for approximately 85% of the lung adenocarcinoma associated with KRAS. Additional mutation at KRAS at G12 residue and at residues G13 and Q16 are found. KRAS is small GTPase that activates downstream pro-growth and survival pathway when it is bound to GTP. And oncogenic KRAS mutation commonly lead to impaired GTPase activity. Most EGFR mutation either small in frame. Most EGFR either in small inframe in exon 19 or L858R point mutation. EGFR mutation either in exon 19 or L858R point mutation, which represent approximately 50% of all cases of lung cancer. Additional less frequently observed EGFR mutation include exon 20 insertion mutation, EGFR G719X, L861Q mutation. EGFR is a member of the ERBB family of RTK, which include EGFR, ERBB2, also known as HER2, ERBB3, ERBB4. Lung cancer associated with EGFR mutation are found in exon encoding the tyrosine kinase domain of this receptor, and the mutation lead to constitutive activation of the RTK that cause uncontrolled proliferation and survival by activation of the MAPK and PI3K signaling. Exon 19 deletion and L858R mutations were initially found to exhibit sensitivity to the first generation adenosine triphosphate competitive reversible EGFR tyrosine kinase inhibitors, gefitinib and erlotinib. The initial observation in 2004 of this connection between EGFR mutation and sensitivity to tyrosine kinase inhibitor transformed the diagnostic and treatment landscape for non-small cell lung cancer and stimulated the research for additional targetable oncogenic driver and drug for this disease. ERBB2 mutation in frame of exon 20, 3 to 12 base pair insertion mutation have been identified in 1 to 4% of the non-small cell lung cancer, most frequent in adenocarcinoma and never smoker. A 12 base pair insertion mutation of in ERBB2 lead to duplication of the amino acid YVMA accounts for most lung cancer associated mutation in this, and point mutation can also occur and accounts for approximately 10%. 10% of ERBB2 mutation in non-small cell lung cancer. Mutation also affect exon 14 of MET in 3 to 4% of the cases. Exon 14 encodes the site for binding of the E3 ubiquitin ligase, which is important for MET degradation, and the mutation interferes with CBL binding, leading to sustained levels of MET activity. MET amplification is observed in 1 to 5% of the non-small cell lung cancer at baseline, and 5 to 20% of the EGFR mutant tumors with acquired resistance to TKI. Mutation in BRAF is observed in approximately 3% of the lung adenocarcinoma associated with a history of smoking. So BRAF V600E accounts for 50% of the cases, followed by BRAF G469AV. Fusion. ALK rearrangement juxtapose the ALK sequence encoding its tyrosine kinase domain with 5' fusion partner, most commonly AML4 in lung cancer, leading to the production of a fusion in which ALK is constitutively active and thus engaging pathways that lead to uncontrolled cell proliferation and survival. The discovery of the ALK fusion paved the way for the identification of additional gene fusion involving RTK in non-small cell lung cancer. Gene fusion involving ROS, RAT, and TRK1 to 3 are found in 1 to 2%. 1 to 2% and 0.2% respectively. Similar to ALK fusion, ROS, RET, and NTRK lead to constitutive activation of the tyrosine kinase and activation of downstream pathways that promote cell proliferation and survival. So, clinical characteristics of patients who the tumor harbor ROS and RAT fusions are similar to those observed for ALK, and there is more viability of anti-RK fusion cases. So, an NRG1 gene fusion involving CD74 as a 5' partner is found in 0.14 to 0.4% of the lung adenocarcinoma and are enriched in invasive mucinous adenocarcinoma. NRG1 is an ERBB3/4 ligand and is targeting the ERBB signaling and is being investigated as an approach to treat this subset of tumors.